we understand that you have a question about a medication you'll be receiving.
Yeah, I was pretty familiar with most of the medications, but heparin kind of brought some more questions. So.
All right. Well, this drug here is an anticoagulant and an antithrombotic, and we're going to give it to you as an IV and sub-Q, and it's a Class C pregnancy risk, so which doesn't affect you obviously because you're a male.
No. So sub-Q injection means that it's just under the surface of the skin, so the needle won't get deep enough to reach a muscle, and it won't be in a vein or an artery. It'll just be in like fatty tissue, so it'll probably be into you in your abdomen. And so like what it will do is it prevents platelets from sticking together and in your veins. And
Hold on, platelets?
platelets? Okay, so platelets are they're what cause your blood to clot. So like if you get a cut, then platelets gather at the site of the cut to stop bleeding. But the thing is, because your leg will be stationary for a long period of time, the blood won't be moving quite as much. And so that puts you at a higher risk for thrombosis or clot, which is platelets gathering together. And that could either close off like a vein in your leg, for example, or that could move as what's called an embolus into your lungs and get stuck there, which is even worse. Or so there's various things that can come from that. But this will prevent that clotting that shouldn't happen. So.
Do you have any other questions?
I was kind of noticing some of these adverse effects, and I'm not really familiar with erythema. Is that how you pronounce that? Or?
Erythema, that's redness of the skin, and that'd be very bad because you have the redness of the skin, especially at the injection site, it could be an infection or something could have went wrong with the injection. So we need to make sure we know that right away.
Okay, and I think that's about all. Maybe anaphylaxis. I'm not really familiar with that term.
This is a term used to explain the possible allergic reaction you could have, and you can go into shock with this. So this is also a fatal thing that we want to watch out for. And also, there's some side effects on there that I don't know if you read or not, but they all have to do with bleeding because this drug, like we said, it deals with the platelets. So you want to make sure that you don't have any abnormal bruising, any cuts that are bleeding excessively. We want to check your gums to make sure there's no blood in your gums. And yeah, so that's about all. Unless you have any more questions.
No, I think you guys basically covered most of my questions. I appreciate your guys' time.
Yeah. If you have any more, then be sure to let us know.
Well, we're going to leave so we can let the doctor come in and see you and talk some more about your procedure.
All right, thank you. I appreciate it. Have a good day.
So.